So this video is all about hand expressing. So hand expressing can be used antenatally and postnatally. Some women might decide that they wish to get a colostrum store antenatally from 37 weeks in case their baby might require special care units. So especially if we know that babies may be poorly, may have a congenital defect, may need to go to the neonatal unit because mum is gestational diabetic or diabetic in general. Also in the postnatal period, especially in those early few days, there might be a few reasons as well, such as to tempt your baby to the breast. So if your baby's a little bit reluctant to feed and you just need a bit of enticement to the breast, then expressing a little bit to the end of the nipple can also help sort of initiate that natural rooting reflex. You might also want to do a bit of hand expressing to relieve some fullness, especially when milk supply is trying to regulate in those early days. You might also need to hand express to clear a blocked duct. So you might need to be sort of massaging one particular area to try and free that duct up. And also if you are separated from your baby, so if baby is in the neonatal unit and you want to provide your baby with colostrum, then hand expressing is the best way to train the breast in those early days, along with doing it throughout your breastfeeding journey. So to start hand expressing, it's really important to try and get yourself into the right frame of mind. So you need to be really relaxed. So we do recommend that you get something close with you that reminds you of your baby. So if your baby's not with you, it's on the neonatal unit, get a piece of clothing or one of their little teddies. Look at pictures or videos of your baby. If your baby's with you, then put baby skin to skin. Because what you want is that oxytocin levels to be really high, so that love hormone to allow your letdown to happen. And what you can also do is start sort of massaging the breast. So just a bit of sort of massage can help, a bit of warm compress, anything that just sort of helps you feel quite relaxed. So a bit of massage always helps, so just sort of massaging the breast tissue. Then what you do is you make a C shape with your fingers and you feel back about 2 to 3 centimetres from the nipple. It's where the texture changes. And all you do is compress and release, and compress and release. In those early days, it might take a little while for that milk to start coming, but you'll just see little droplets on the end of the nipple. And what you need to do is just keep going in the same area until that supply sort of stops, till it eases. And what you need to remember is actually the breast is like an orange, so there's segments all the way around. So once you do hand expressing in this area, like this, then you want to move to this area, because what you're aiming to do is drain all the different ducts around the breast. So like I say, it's just purely feeling back 2 to 3 centimetres with your fingers in a C shape and compress and release, compress and release.